Ladies and gentlemen, good morning. It is an honor to be in this event. First, I would like to thank ADB because ADB has helped Indonesia a lot, not only by giving a grant, but also giving an access to more than 400 millions of loans dedicated to the vaccinations supply to fulfill our requirements of 426 million doses by the end of this year. We strongly believe that vaccination is one of a critical steps that we have to overcome, to erase this pandemic. But it is not the only one. Based on WHO framework, we need to do 4 key strategies at the same time. The first one is we need to improve our public health systems and improve the new health protocol standard to make sure that it's aligned with the new pandemic. Observing with the previous pandemic, starting with the largest one, the Black Death in Europe back in 1300, or even the global epidemic, we call it the HIV, that also killed more than 10 million people globally, we observe that we need to change our behavior. That is a new standard protocols that we need to do. And that is exactly the first strategy, how we can overcome this pandemic. The second strategy that WHO also shared with us is how can we do surveillance of the people that got caught with the virus. Since every pandemic, the objective is to reduce the transmissions of the virus. If we can reduce the transmission rate of the virus to a level which is controllable, then we can control the pandemic. And it will become a normal epidemic. There is no proof historically that pandemic can finish in 1 year. They will stay with us for the next 2 years, 5 years, or even 10 years. So the way to control the pandemic is to make sure that we can reduce the transmissions by doing a proper surveillance and quarantine those people. So the surveillance or the diagnostic strategy as the second pillar that consists of the testing program, the tracing program, and isolation program is something also that we quickly improve day by day to make sure, again, to reach our objective to reduce the transmission rate of this pandemic. The third strategy that WHO shared with us is the vaccination program that we will share with you later on. And the fourth strategy is if our brother and sister got the virus, then we need a therapeutic strategy. We need to increase the number of isolation beds. We need to make sure the number of health professionals are ready, and we have to make sure that we have a standard treatment, clinical pathway, and medicine. So those 4 strategies is being implemented by us in Indonesia, and we have a lot of support from ADB. So how to improve the new standard protocol, the new public health system that align with the standard protocols. The second strategy is on diagnostic and surveillance. The third strategy on the vaccinations, and the fourth strategy is on the therapeutic strategy. And now I would like to close my speech with the vaccination program that Indonesia is doing. We have to vaccinate 181.5 million Indonesians. We need 363 million doses of vaccine. And we are very lucky. We are one of the countries that can secure the vaccine early. So we can secure the vaccine to vaccinate 181.5 million or 363 million of vaccines coming from 4 sources: Sinovac China, Novavax United States, and AstraZeneca UK, and also BioNTech Pfizer, which is invented in Germany but work with American firms. We have 4 of them because we would like to spread the risk. If something happened with one producer, we have another one. And these platform also coming from a different vaccine technology, not only inactivated virus, but also a factor based and also recombinant based and also RNA based. So we cover all the technology and also cover all the different source of country to make sure that we don't put all of our eggs in one basket. And we are very lucky that we can get the doses early since January. The reality is that we can only secure 80 million of the productions of the vaccine by June, and we will have the rest on the second semester. That means that the number of doses are limited until June. And we pace our vaccination jabs every day based on the availability of the vaccine. Currently, or at the beginning, on January and February, we only have 3 million doses. That's why we pace our vaccinations 100,000 per day, because we only have 3 million doses. Starting on March and April, we have 10 million doses every month. That's why we increase our vaccinations capacity between 300 and 500 million jabs per day, which is yesterday we passed our 400,000 jabs benchmark. So hopefully we can increase gradually to reach 500,000 jabs. On May and June, we will receive around 20 to 25 million vaccine per month. So that's why we will increase again our capacity to 1 million jabs per day in May and June. And after that, we will have 40 to 50 million doses of vaccine every month until December, starting from July. That's where we will increase our vaccination capacity above 1 million jabs per day, between 1.2 to 1.5 million jabs per day. So everything is planned, and we would like to finalize the vaccination program by the end of this year. Our current schedule is 15 months until March, primarily because of the availability of the vaccine is only be available until March, but we try to find a new ways to accelerate the delivery or the availability of the vaccine by using another channels or working with multilateral agency like Gavi. So we can accelerate the availability of the vaccine, and hopefully we can finish by the end of this year. Why we would like to do it? Because nobody knows now what is the period of efficacy of the vaccine that we have. It can be 12 months, can be 18 months, can be 24 months. Nobody can confirm scientifically now. So we took a conservative calculations. If we need to get the herd immunity, it means that we have to vaccinate all the target people between the efficacy period of the vaccine. And we assume is 12 months. So that is the reason that we would like to accelerate. It's also reduce the potential of the new strain or mutations of the virus, because we just identify also that the UK strain is already here. But again, hopefully, with the vaccination program, we can strengthen the defense of our health system in this country. And hopefully, with the new standard protocols that we enroll and try to discipline our people using the existing public healthcare system that we have, it will also will reduce the transmission rate of this virus. And at the end, it will control the pandemic. I'm regularly monitoring our reproduction rate. A reproduction rate means that if one people got this virus, how many people he will transmit this virus. Now Indonesia is 1.02, going down consistently from 2.1 at the beginning, and hopefully we're aiming before the anniversary of Indonesia in August, hopefully we can push it down below 1. So that means that the number of people that got infected is less on the previous day. So that means we can control this pandemic. If we can do that by this year, hopefully next year we can live normally with this virus as a normal epidemic, like another influenza virus or another diseases. and we'll live with this virus for years to come under a controllable health system. So again, thanks a lot for ADB for all of the support. We get a lot from you, and hopefully this can be used as an example. If a country open itself, working with multinational organizations, that we can benefit all of the people in that country and also can spread the good news to another country. Again, thanks a lot for my ADB colleague, and looking forward to working with you in the future engagement. Thank you.